Hey everybody, this is Dr. Leslie Valbrun presenting you with some information on COVID-19, also known as the coronavirus. Now, the purpose of this video is not to promote fear, but actually to promote certainty, clarity, understanding, confidence, and courage. Now, hopefully, I'll be able to provide you with some information that will shed some light on this issue and hopefully put you in a position where you're not fully affected. And even though you are affected because of the pandemic, but you're actually putting yourself in a position where you can either prevent getting the disease and or you can help manage the disease. So first things first, what is coronavirus? Well, COVID-19, what that stands for, CO stands for corona, the VI or the V stands for the virus, and D stands for disease. So coronavirus disease, and 19 stands for the year 2019. So that's when you started seeing cases. That's when we started realizing that this was actually an issue. Hence the corona or COVID-19. Now, that can stem, coronavirus 19 or COVID-19 comes from the COVID A, also known as the SARS or the ARDS, which actually causes ARDS. Now, ARDS is acute respiratory distress syndrome. And what can happen is your lungs get affected, and then it becomes a tough battle to either eradicate the disease, get rid of the disease, or just to kind of get you back to a place of normalcy. All right, so viruses are very tricky in that they change all the time, hence why we get flu vaccines every year. They change, they're constantly morphing, they're constantly running amok, so to speak. But really, in this case, we're going to provide you with some information that you might already know, and then some information that you may not have known. So, how do we stop the spread of the disease? Then, how do we identify the disease? And then, who's at risk? And then, what can we do in terms of our nutrition, in terms of our lifestyle to help prevent the disease? So, first things first, how do we stop this thing from spreading? One of the things that we've heard is social distancing. But why social distancing? Well, social distancing primarily is for individuals who may have already had the disease. And you want to prevent the spread of the disease itself. And the reason why it's so important not to spread this disease is you don't notice the symptoms right away. It's not like an Ebola. It's not like a SARS where once you get the disease, right away you start to present with issues. In reality, this issue with COVID-19, you can have it up to 1 to 14 days before you actually start to see symptoms. And so that's why we're doing this prevention. That's why we're keeping people away. Instead of doing like a herd immunity, what they're trying to do is actually prevent people from going out if you're a non-essential worker or those types of things. Now, what does that mean in terms of hand washing? Well, keep your hands clean. Yes, Purell and those other type of hand sanitizers, yes, they can definitely help, but they've got to be up to about 60%, I believe, of the alcohol or a cleansing material. So it's got to be at least that. So that's something that you can do to help clean your hands a little bit and prevent. But the best method is to hand wash for at least 20 seconds, minimum 20 seconds. Wash your hands and keep them as clean as you can. Now, with that being said, why do we need to keep our hands clean? Well, there are three major places that cause any flu-like symptom to get into your system. Number one, your mouth. Number two, your nose. And number three, your eyes. And in some cases, your ears. So you want to reduce the rate of touching your face and or touching those areas, especially when you've been out and about and you've been touching a lot of different things and you can't get to either a hand sanitizer or to either wash your hands. Now, that being said, there are other things that are important as well. One of those things is if you're sick, please stay home, quarantine yourself, And then, when you start to feel better, okay, you can definitely go out there. If you need to go see a doctor or a medical professional, by all means do that. There's also something called telehealth. Now, in Connecticut, where I am, the governor has approved telehealth. So if you have a healthcare provider that you need to speak to, you're concerned about your health, or there's something going on, you can absolutely give a call to your provider and have a consult or a visit right over the phone. Now, that being said, let's talk about some of the other symptoms related to COVID-19. Number one, that dry cough. You're not going to see a whole lot of mucus. You're not going to see phlegm, that kind of thing, or even like a nasal drip. That you will actually see when it relates to your seasonal allergies or even your general influenza or your flu. Those are those kinds of symptoms. But in this case, you'll see a dry cough, you'll see fever, fatigue, and in some extreme cases, difficulty breathing. That difficulty breathing, though, once you've gotten to that point, you need to actually get to the hospital. You need to get to a place that can take care of that pulmonary issue. That is important. Now, risk factors. Risk factors, we know that everybody's been talking about the age issue. Oh, it's mostly elderly, and you'll see a lot of these younger folk going into spring break and having a good time. Look, I just turned 21. I want to have fun. And I can completely understand that. But it's not just for old people, okay, or older populations. And it's not just for extremely younger populations either. It is actually anyone can acquire this issue, but you just don't know whether or not you have it, and putting someone else at risk is a major problem because it can lead to death. And so we want to reduce the amount or reduce the rates of acquiring the disease and also someone from dying. We don't want that to happen at all. That being said, there are other risk factors. Number one, an autoimmune disease. If you have like a tumor or cancer or an autoimmune suppressing disease, that can increase your rate of getting or acquiring this disease. There's cardiovascular disease. Now, cardiovascular disease is actually the highest rate of death related to a coronavirus like this. So if you have a heart condition, you absolutely want to get checked. You absolutely want to find out whether or not you've acquired this disease. There is pulmonary disease. So if you have any lung issues, any issues related to if you were smoking or if you had a lung cancer or anything like that, you're putting yourself at a greater risk for disease. So if you smoke, please try to stop as much as you can because we want to reduce the rate or reduce the incidence of disease for individuals with lung issues. Now, diabetes or any inflammatory condition can also be affected, and that can lead to other issues, right? So we know that diabetes lead to a lot of other chronic diseases, which can put you at risk for other issues like coronavirus. Now, when it relates to what we can do to boost our immune system, well, there are certain principles that we can take. One of them that I particularly like, it's this company in Weimar, California. It's called New Start. And New Start stands for nutrition, exercise, water, sunlight, temperance, air, rest, and trust. So I'm going to break that down just a little bit. What that is nutrition. You are what you eat. That's just what it boils down to. You are what you eat. Exercise, get out there, 30 minutes at least of walking. And when I say get out there, I don't necessarily mean going outside, but you can go outside. It doesn't mean that you have to be completely isolated. If you want to go for a nice little hike or a nice walk, you can definitely do that. So water, you want to at least be drinking about half of your body weight in water. One of the things in my office that I promote all the time, you have to drink water consistently. You've got to get enough water in your system because if you're not flushing these things out, the likelihood of you keeping disease or not getting better at an expeditious time or expediently um, causes some issues and can cause issues long term. So please drink water. It's absolutely, absolutely necessary. Sunlight, got to get some sunlight. Sunlight by itself is antiviral. So, got to get that sunlight. And it makes you feel so much better about yourself. It's one of the reasons why during the summertime, when the days are a little bit longer, we feel great. And then during the wintertime, sometimes we're just like, this is terrible. Uh, Rest, of course. Oh, wait, I skipped one. Temperance, meaning limit the sugar, limit the salt, limit the fatty acids, limit your alcohol consumption, and of course, limit your tobacco consumptions if you smoke or if you drink. Then there's air. You want to get some air. Open those windows, let the air get through, clear things out, and then after some time, close those windows so that at least you're filtering the air and it's not something that's staying in this one area. And then rest speaks for itself. You got to get good rest. Now, one of the good things about quarantine is that you can get some rest. You can actually have some time to get some sleep, minimum of 8 hours a night. That's the standard. That's what we all know. Okay. And I won't dive into that too much, but the darker the room that you sleep in, I can guarantee you this, the darker the room that you sleep in, generally the better sleep you get. And when it's uninterrupted sleep, is generally the best sleep. So definitely get your rest. And trust. Trust is the final thing in the new start. That means exercising your faith. Now, we know that individuals who have a faith or a faith system that they believe in, they do better than individuals who don't. So whether it's Buddhism, Christianity, Judaism, whatever it is that you believe in, you must believe because it's absolutely important to have that trust, to have that faith. Now, myself, I'm a Christian and I believe in my faith and I believe in my God that, I will absolutely feel better and get better and move forward and help others. So that trust gives you that confidence, that certainty, and that courage to move forward. Now, what happens is when you exercise faith, okay, when you exercise faith, you reduce fear. And when you reduce fear, fear reduces stress. And when you reduce stress, that actually boosts your immune system so that you're not acquiring all of these other diseases. Now, I can go into that and talk about psychoneuroimmunology. We can talk about that at length. But really, that's the concept. Just reduce your fear, reduce your stress. It increases your immune system. All right, now to the juicy stuff. This is the part that I've been waiting for to get to. So I hope you've been sticking with me throughout this video. All right, here goes. Nutritional supplements that you can take to prevent this issue from being an issue. And or if you have the issue, what you can do to prevent or reduce the actual coronavirus from attacking your body. All right, so number one, vitamin C. We all know during flu season, vitamin C is a big deal. People take it in droves. Well, your body can metabolize vitamin C 1,000 units, okay, per hour. That's generally where it is. And whatever your body doesn't use, you lose. It just takes it right out. So get that vitamin C in your system. I say a minimum of 4,000 to 5,000 international units or milligrams, whatever it is. Get that in your system. So 1,000 units of vitamin C per hour, okay, up to about 10,000, and or up to diarrhea, because what happens is you can get diarrhea by having too much vitamin C that you're ingesting orally. Now, there's other types of vitamin C where you can do an injection, but that has to be under under the direction of a medical professional. Okay. There's also something called liposomal vitamin C, which is a liquid form of vitamin C, and it's generally a higher, is a little bit more effective than your general vitamin C. But Vitamin C is absolutely important. The next one is zinc. Getting zinc in your system is great for attacking viruses because they're all antiviral. Okay, so get some zinc in your system. Selenium. Now, I can stay here and talk to you about biochemistry the entire time, talk about cell development, all that other stuff. But selenium is absolutely important. Why? Because it increases the production of glutathione and also some enzymes related to that. That is absolutely imperative for breaking down and for preventing uh, any virus, really. And so, hence COVID-19. Then there's N-acetylcysteine, also known as NAC. All right, so N-acetylcysteine is also great for combating viruses. So if you have any virus, it's absolutely important. Let me go back to selenium just real quick. So if you look at studies, don't take my word for it. Go online, find some peer-reviewed articles, especially related to African areas, let's say that have had like HIV or AIDS. Those who have selenium in their system at a higher rate have a lower rate of contracting viruses. So that's really important. That's why I was pointing that out. Now, lysine. Lysine is usually associated with like, herpes virus. Now, when we say herpes, I don't just mean, genital herpes. I'm also talking about herpes simplex 1, so like your cold sore, and then there's also, let's say your chicken pox, your varicella, zoster. It can also help for that. So lysine, think about lysine means to cut. So lysine will actually help with the virus. So then you have vitamin D3. Now, vitamin D3 is one of my favorite. You can get vitamin D3 with sunlight. Sunlight can actually give you vitamin D3, okay? But taking it is also a good thing. I would also say take about 10,000 international units or micrograms or milligrams, whatever it is, daily. Now you can take up to 2,000 per hour so that it can metabolize in your system, and that will really boost your immune system. And at the same time, during the darker periods of the year, it actually reduces SAD, also known as your seasonal affective disorder. And omega-3 fatty acids. Now, most people say omega-3 fatty acids. Why? Well, it's about cell protection and cell development. You want to make sure that these things can actually get in and out of your cell in a way that is most effective. Now, with omega-3 fatty acids and even some of these other meds, you won't really feel anything different, okay? But after about 6 to 8 weeks, your body is going to be in tip-top prime shape. And when you stop taking these things, you're going to actually notice. The last one, which actually is pretty important as well. So it's pycnogenol, okay? Now, you can get pycnogenol from a variety of sources, but the best source, if you just go online and just look it up, the best source is the French maritime pine bark. You can also get it from grapeseed, and you can also get it from witch hazel bark. And I think there's another one with peanut oil. I don't know if it's peanut oil or the skin of the peanut. Nonetheless, if you have a peanut allergy, stay away from that altogether. However, the French maritime pine bark is actually really good, or the grapeseed if you're allergic to that or whatever. But just know your body, know what you actually need. So guys, these are some of the things that you can actually do to prevent disease. This is what you can do to actively and consistently improve your health. I hope that this video has helped provide some certainty, some clarity, confidence, and courage in knowing exactly what to do, and knowing what the risk factors are, and knowing a little bit more about COVID-19. God bless you, good luck, and have a wonderful rest of your day.